Hello everybody, my name is McKenna. Today I'm going to be critically appraising smart pumps and how they integrate with the electronic health record, or EHR, and the electronic medication administration record, or the EMAR. So the place that I chose to critique is Reading Hospital, which is a part of Tower Health. The mission statement of Reading Hospital is to provide compassionate, accessible, high quality, cost-effective healthcare to the community, to promote health, to educate healthcare professionals, and to participate in appropriate clinical research. As you can see, Reading Hospital has a lot of different specialties and they provide care to a variety of different patients. They're also always expanding. Recently, they bought 6 hospitals and they have a lot of outpatient clinics as well. I'm not going to read these all to you, but if you would please take the time to look over them whenever you have a chance. So Reading Hospital contains 714 beds and they have 22 different buildings. The personnel are always changing, so it's hard to determine the exact number of people working at the Reading Hospital at this very moment. They are considered the second largest employer in Berks County in 2018 and 2019. As of September 2019, the hospital has 7,592 employees. There's a variety of staff, including 970 physicians and healthcare professionals in 53 different specialty areas, as well as dietary, pharmacy, environmental services, human resources, and many more. So there are 2 different people that I interviewed. Both are clinical staff members. Neither of them is in a leadership role. However, they both have valuable information to provide based on their education, clinical role, and their interpersonal contributions. Amber's a clinical nurse and a user of healthcare technology systems. She works on a medical surgical unit that frequently uses the smart pumps, and she can provide an unbiased opinion. She's also a super user of the Rover, which is a mobile smartphone that is used for patient care, which I'll discuss a little bit later in this presentation. She also recently obtained her BSN, so she has been educated on different technology systems as well as their advantages and disadvantages. She's also aware of all the resources that exist for clinical nurses who need help with technology, so she'll be able to provide valuable information on the organizational support that exists at Reading Hospital. Mark is also a clinical nurse and user. However, he can provide a different view than Amber can. Number one, he's an informatics resource nurse. So he attends the monthly informatic meetings. He's aware of new technology that might be integrated into the hospital. He also receives training before all other employees on new technology. This training is specialized to help educate employees and also to help troubleshoot issues in real time. He's also considered an organizational support person because he is a super user for the smart pump and the Bane viewer. He's also working on his graduate degree in informatics. This gives him an edge because he's extremely knowledgeable about all different technology systems and understands the resources the hospital provides. He can also provide a greater insight into technology, specifically smart pumps, and how they impact healthcare and the people that use them. Reading Hospital is an innovator when it comes to technology systems in healthcare. Almost everything is digitized. As you can see on the slide, there's a vast amount of technology systems and vendors. For time's sake, I'm not going to read these all to you, and we will be discussing their purpose a little bit later on in this PowerPoint. So just take note that the vendors are actually in teal. Reading Hospital also has some of the most advanced radiology equipment. For example, they have 2 64-slice CT scanners. This is the first in Berks County. They also have a portable head scanner, which is the first in the state. And they have a 3 Tesla MRI machine. This is the most advanced MRI machine in the region. The purpose of all radiology equipment is to diagnose and treat patients effectively. Again, the vendors are listed in teal. Some of the stuff here, I'm going to go over the purpose of the technology. For example, we have Voceras that allow us to communicate with all staff in the hospital in real time. And as you can see, the top picture there is a picture of a Vocera. There's other features that the Vocera provides that is listed on the slide there, such as you can set reminders for yourself and broadcast to groups. My telehealth is the personal health record that we use at the hospital. It allows patients to manage and maintain their health care by an application, and they can do this from home. Other features of the personal health record are also listed on the slide. The EHR is an electronic version of the chart. It has medical history, diagnosis, treatment plans, allergies, and so much more. It also provides insight and secure access for users. It provides evidence-based tools. It is automates and streamlines workflow for all employees, and it allows healthcare providers and physicians to share information with one another. The EMR is automatically charts medications into the electronic health record using a barcode scanning system. Again, I'm only going to go over a few of these just to save some time, as a lot of them are self-explanatory, and I'm sure a lot of you use these every day at your profession. So I want to talk about charge capture. This allows nurses and other staff members to charge patients for supplies that they use. The Tog robots deliver foods to patients, and interestingly, they are actually named after the Jetson characters. They also have the ability to deliver medications, supplies, in labs, and they can do waste removal as well. The vein viewer is rather new, and it's a wonderful piece of technology. It is actually a near-infrared vein visualization product that's used for IV sticks. It can help visualize veins, bifurcations, rolling veins, catheter flow, and hematoma formation. This reduces the amount of failed attempts that nurses have. Also, it decreases central line placement and increases patient satisfaction due to the decreased amount of sticks. The Da Vinci surgical system is also an amazing piece of technology. This gives the surgeon an advanced set of tools that they can use to perform minimally invasive surgery with robotic assistance. It allows for greater range of motion. The physicians can actually view high-def 3D surgical areas, and they can operate through small incisions. Lastly, the Riva allows pharmacists and their staff the ability to automatically compound IV medications, and this is a reliable and accurate method of doing this. This increases patient safety and reduces human error. The rovers are also something I wanted to talk about, as Amber is a super user of these. They are handheld, standalone devices that allow the user to access, read, and chart on the electronic health record. You can also perform medication administration and securely take pictures for the chart. So I want to talk a little bit more about smart pumps, as that is what this appraisal is all about. Smart pumps are IV pumps that can transmit wireless signals to and from the EMR, causing the IV pumps to self-program. They also contain dose error resolution software, and they allow the organization to program a tailored library of medications that have dosing guidelines. These guidelines have the ability to detect dosing and programming errors that may cause potential harm to patients. The pumps also provide data to help improve safe practices, and they can be used to investigate pump-related errors and good catches and risky practices. In order for these to work, they're going to require a wireless connection, and they have to have the ability to integrate with the EMR and the barcode scanning system. Without certain technology, other technology wouldn't be able to work properly, and because of this, they must be able to interface with one another. They don't all have the same vendors, but they're also able to integrate, which is kind of amazing. So below, take your time to read, is a list of interfaces that occur in the hospital. So Amber and Mark both agree that the smart pumps are easy to use, but that they have some disadvantages. Amber believes that the interface between the EHR and the Alaris pumps are clumsy and not user-friendly. She states that they're not always next to each other, the pump and the computer, so the nurse has to take multiple trips back and forth to the pump and the computer. This can be very difficult in a crowded room with equipment or people. Also, it requires multiple steps in the process. This process can be lengthy, and especially when hanging multiple medications. She does state, however, that it is efficient and effective. However, Amber would prefer to manually program her pumps, as she is quick at this and it saves her time. Mark also likes the smart pump and agrees with Amber that it can be tedious and time-consuming. It can slow down workflow. If errors occur or a wireless connection is spotty, it can also take a while to resolve this. You may actually have to repeat the process multiple times in order for the med to be sent to the IV pump. It's easy for errors to occur as well, especially if hanging multiple different meds, because you can scan the wrong barcode by accident. This could be missed if it's a busy day, and it can increase the risk of fatality, especially with high-dose medications. For example, Reading Hospital uses heparin bags that are clear, which can also be an issue because it can be very hard to scan clear bag medications, which causes the nurses to override the pumps. Some medications as well, like PCA pumps, still require manual entry, which can leave room for human error. Although Mark says there's some disadvantages, he still believes that they should be used because he understands the benefits they provide, especially reducing the risk of medication errors. which is one of the largest causes of patient deaths in hospitals. So we've already talked about some of the advantages. For example, if the pump is easy to use, you do not have to manually program the pump, which for some can actually be very tedious. Also, it decreases medication errors, which reduces healthcare costs. There's a reduced risk of adverse drug event rates, which is more likely to occur with high-risk medications. The pumps also collect data, which can be used to improve quality and practice and create financial improvements. Again, we discussed some of the disadvantages. The pumps can malfunction, they can slow down workflow and lead to overrides, increasing the chance of human error and medication errors. Some medications are also hard to scan, as I talked about the clear medication bags, so the nurse has to override the pumps. Not all the medications can be scanned. Again, talking about the PCA pumps, they have to be manually programmed. It's not very user-friendly. It requires multiple steps to program the pump, and it sometimes requires the nurse to walk back and forth between the pump and computer multiple times. In general, smart pumps also have a low compliance rate, and like as we discussed, the barcodes can be scanned incorrectly, which can lead to detrimental medication errors. So Reading Hospital provides a large amount of strong resources for the staff to use. They have hands-on training and they have support staff that walk around the unit whenever a new technology is integrated into the hospital. They also have great support staff. They have 24/7 IT help through a help desk, which they can remotely access the computer. They can help you troubleshoot and answer questions. They also have Epic Help Center, which has trained IT staff as well as informatic nurses. So you can actually call into the center and make suggestions for change, and these nurses will try to incorporate that into the charting system. However, they're not open 24/7, which can be an issue, especially on the weekend. And if IT is unable to resolve the issue, you may have to go to the Epic Support Center. Biomed doesn't directly deal with information technology, but they do help maintain the equipment and fix any errors that may occur if it breaks. They also have resource nurses and an informatics team. The resource nurses on each unit, they also must attend the informatic meetings, and they help answer questions about technology and provide real-time help. Lastly, the hospital has super users. The super users are great. They are trained staff nurses as well as management, and they help nurses on the floor even after the training period is over. Amber is a super user for the Rover, as stated, and Mark is a super user for the smart pumps as well as the vein viewer. The only lack of support is if you dislike how something works, there's not much room for improvement because the hospital is bound by the offerings of the manufacturer. So major issues. At Reading Hospital, there was a recent breach that required the hospital to close down multiple different units and to contain the malware and the breach. This leaked to patient information, so patient confidentiality is a major issue. Also, junk email. This is something you can receive multiple times throughout the week, and sometimes it's hard to determine which emails are junk. These emails can cause a breach, which is another issue with patient confidentiality. There are multiple parties involved with decision making about information technology. If you view the slide, you can see some of these resources. Epic is a huge part of this because Epic, everything integrates with the EHR in Epic. So recommendations, I suggest that they add Wi-Fi repeated extenders in all patients' rooms. These actually boost the wireless connection, and the Wi-Fi is required for the smart pumps to function. This can be patchy in some patient rooms and decrease functionality. This will, over time, decrease overrides and increase compliance. Also, they should improve the barcode scanning accuracy and distance. This will decrease the need for the nurses to move about their room multiple times. This will also increase compliance and decrease overrides and med errors. Medication should also not be supplied in clear bags. As discussed earlier, these can be hard to scan and lead to med overrides. PCA pumps should be integrated into the smart pump technology. This will help decrease medication errors. Physical barriers should also be provided between the pumps. This will decrease the risk of scanning the wrong barcode. And lastly, I think the hospital should provide a tips and trick card for troubleshooting the smart pump problems that can occur to decrease user frustration. I want to thank you all for viewing my slide. If you have any questions, please ask. I'm open to all and any questions, and here's a list of my resources. Thank you.